and this is what it all gets down to. What is medicine? Like my sister, when she made a dietary intervention to a patient who had chronic migraines, her attending surgeon at Stanford said, "Don't be a pussy." Literally used that phrase and said, "We didn't go to dietary school. Serious medicine is interventions." Like we're trained that, and doctors are trained, and really societally, that nutrition and supplementation, exercise isn't serious medicine. It's only cutting people over or prescription pad. That's not right. And it's actually not how medicine is defined. So the IRS tax code defines medicine as what a doctor says is useful in preventing or reversing a condition. So, and then there's been a lot of case law on this. So if a doctor recommends food or recommends exercise interventions or recommends supplementation or recommends a sauna or recommends other root cause items, it does count for medical spending. And the fact that this is news to people, the fact that very educated people, nobody knows this, we're working to evangelize it. That is a black mark on the medical industry. I just want to be very clear, and this is under current law. It is an absolute scandal that the hundreds of millions of meetings in the United States between a doctor and a patient when an American is showing the first signs of metabolic dysfunction, that it's an immediate prescription pad and a statin, an SSRI. 25% of women are on some kind of psychiatric drug in this country. Like it's just boom, boom. The fact that they're trying to shove Ozempic down our throats as the standard of care for 12-year-olds who are overweight or obese, it's like this is just not clinically appropriate. And that doctor, I believe, who's lunging for the Ozempic or the statin or the metformin prescription before doing what they have every ability to do, which is take out a piece of paper and write a letter of medical necessity with a detailed dietary or exercise plan that then unlocks tax-free spending and medical spending, that could be done right now under current law. So what I would recommend is you expand flexible accounts and actually shift a lot of the budget into those accounts. So, people on Medicaid, lower income people, HSAs are a tax advantaged vehicle. A lot of them don't really even pay taxes. But if they have an account, again, then I would be working on shifting this broken top-down system of that $1.5 trillion of Medicaid that I mentioned. Start putting more of that money into people's accounts and trust that mom to make the right decision for her kids. There's just this pessimism towards the American people.
If you give it to them, they're gonna mess it up. They're gonna waste it. They're not gonna know what it is. We know better because we're the government and we're the institution. We'll figure it out for you.
It happens with schools, right? This is very similar to school choice. You talk about voting. How can somebody be? These people are too stupid to have an ID. It's just like you really think about how our public policy views the American people. Like it's just like parenting or just like any type of psychology. Let's empower people, have the right guardrails, which HSAs have. You can only spend on certain things that are approved, but let people make their own decisions. So that is something that RFK is talking about, President Trump's talking about. It's actually not that controversial on the left side of the aisle. This is a true kind of bipartisan thing where we should reform entitlement programs to put more money into flexible accounts and let Americans choose. Again, nothing should be about lecturing you to eat organic, but organic food, if you're pre-diabetic or obese, it's just clinically the best medicine. It's just if you're obese and you exercise 4 times a week, get that incentivized and then shift to a high protein, non-ultra processed food diet, you're going to be in a better shape.
Do you think it's a problem with the doctors not knowing that they can even make the recommendations and make a shift? Because sometimes it's just education. Even the doctors themselves, like you said, their go-to is we've been taught that we're supposed to just prescribe. You think if doctors knew more that they would proactively maybe try to shift people towards foods and preventative measures instead?
Yeah, I think there's something really structurally problematic with the way we practice healthcare. I think doctors are good people. There's much easier ways to make money almost to the person they got in for the right reason. But Casey, after graduating from Stanford Med School, going to surgical residency, my sister, she heard a phrase brandished about all the time, which was eat what you kill.
Hmm.
You know, her when she was on her oncology rotation, it's like if somebody, the attending surgeon said, if somebody comes into this appointment room, they're getting a surgery. You know, my mom, sitting across from the senior oncology team at Stanford, who my sister luckily had seen inside those doors, saw her fellow residents crying in the hallways for feeling like they were pushing unnecessary surgery on pancreatic cancer patients. This is rampant, and that oncology team at Stanford was pushing invasive interventions on my mom, who had stage 4 pancreatic cancer. They shamed us for walking out without some invasive procedures.
Shamed you?
Shamed us. They said we were going against medical advice. They said we were being reckless with my mom's life. If we went forward with those interventions, she would have been alone in COVID protocols in the hospital. They actually admitted to us that they only had a 33% chance of extending her life a couple more weeks and actually could have done harm. It was this invasive biopsy they needed to get, and it would have taken 14 days to get a result from. My mom died 12 days after that appointment. It wouldn't have even mattered. And those 12 days with my mom were the most powerful 12 days of my life, where we reflected on her life with her, and she reflected with my dad on their incredible life together, and she read hundreds of messages from people she impacted that would have been dying alone in a hospital room. So there's this intense pressure to intervene that just goes to the basic incentives. That is literally how doctors are comped. Like, they are comped based on the amount of procedures. I was speaking to obesity medicine doctor at Harvard recently, and she said that if she could snap her fingers, that she would cure childhood obesity tomorrow, but she has planning for headcount. And if more and more people don't come in with obesity and then get on the lifetime track of needing to come back and get Ozempic and come back and inevitably have other complications, which is horrible with the drug, and they're modeling that out. Like, they have it all modeled. They just built a new center. They got a loan for that new building. The loan is underwritten by increased patients. Like she's got a staff that all has family support. So, I think doctors want to do the right thing, but no, I think you need to empower patients with flexible accounts and create some demand in that way. I think, if I could snap my fingers, everything would be controlled by patients. And then you have education happening to educate patients, which I think they're starting to learn, that heart issues and high cholesterol are not a statin deficiency, and type 2 diabetes or prediabetes is not a metformin deficiency. Actually educate patients and have them being able to push their dollars to different spaces. That will change the system. But as it stands right now, every single doctor in traditional medicine makes money when more people are sicker for longer periods of time, as just a statement of economic fact. So whatever their motivations are, they are somewhat trapped in that system of 15-minute appointments. And I think this is why that there's a crisis among doctors. The highest burnout rate of any profession, actually an epidemic rate of suicide, the highest suicide rate of any profession.
Because they know.
You're working hard. People working hard on a mission they really believe on. Working hard does not necessarily mean you're going to have like a mental health catastrophe and commit suicide at epidemic rates. That happens when people are working really hard and they know they're not performing and achieving the mission that they got into it for. And that's what's happening in medicine. The New York Times actually had a really interesting article where they compare what's happening in the medical profession to soldiers who are forced to commit war crimes, and actually psychological analysis of the soldiers at Abu Ghraib. That's what's happening to doctors. We have the best, the brightest come to the U.S. medical system. We saddle them with debt. It's all they know how to do. They have all these societal expectations. They basically have one road in life, and they learn too late that the patients aren't getting better, and they're actually not part of the solution, and they get really depressed. Casey saw that throughout the hospital, and Casey, my sister, really had the courage to leave that system. Most people, for various reasons, including the fact that they need to support their families or, important reasons like that, really feel trapped.
It feels like there's this come to Jesus awakening moment happening in a lot of industries, actually. So in the healthcare market, within the doctors, even technology, I've had a lot of conversation with people that made a lot of money in technology. They're like, maybe we were a little responsible with the way society has gone and the mental health problem that we have with our children and the younger generations. People are realizing that the decisions that they made in pursuit of wealth, status, for their own pride and egos, that maybe it wasn't the best, because whatever the decisions were, they seem to have been amplified and created a huge problem. Do you think that may be what it is? That people just...
1,000%. I mean, listen, I'm very optimistic. Like this isn't happening in China or other countries where people on the most popular podcasts are kind of savaging the incentives in our current system. And I actually think it's a beautiful part of the American system where we lose our way and criticize it vigorously. And I think we have existential challenges with our industrial complexes around education, military, technology, healthcare. But like, I am optimistic that it's being talked about. But yeah, I mean, I say this, and Robert Kennedy has been saying this, and I think Trump has said it now, is that there's nothing more profitable than a sick child. There's nothing more profitable than an addicted child. And you look at the most valuable companies in the world, most of them, I think, fundamentally are preying on our dopamine. And, you know, that's definitely the case with tech. It's the case with a lot of, you know, health companies, which are essentially, I think, drug companies. It's the case with food companies. So yeah, I think that's the case. I think, you know, I think it's okay to have vices. Like, I don't think social media should be banned. I don't think Coca-Cola should be banned. I don't think most drugs should be banned. Like, I just think we need to from our scientific authorities to talk about the truth. I think there needs to be an accounting of what's happening, and then culture and public policy come from that. I really think that the problem with these industrial complexes is that the leaders have lost their moral clarity. I think like the teachers' unions on education, which I think is a huge industrial complex, that's basically a jobs program and not, you know, it's not geared towards producing a curious, thriving, educated population at this point. It's other interests have kind of co-opted that. So there's, I think, a total, just utter disgraceful lack of leadership from teachers unions. There's a disgraceful lack of leadership from the, you know, military authorities, which I think have just, I think that the cost of things like the Iraq war, I don't think we fully accounted for it. I mean, the opportunity cost and focus as our kind of main public policy initiative for a decade plus. I mean, it's breathtaking, actually, looking what's happening on the streets of America. And just literally, I mean, it was a waste. I mean, it was a world historical like disaster, and we're still kind of trying to get into more wars. I mean, like the military industrial complex and the forces that led to Iraq was one of the worst decisions in world history when you look at the opportunity cost. I mean, just demonstrably, I don't know. I mean, that seems pretty clear at this point. So we haven't fully accounted for that with the healthcare industrial complex that I think led to the worst public policy decision in the past 7 years, which is the COVID lockdowns, which I think we're going to be, you know, dealing with the ramifications of that for the next generation. I think the COVID lockdowns and the mistakes that were made there and the implications for society are, you know, World War II level historical significance, in my opinion. And that was led by the healthcare industry very foreseeably and very clearly letting us down through horrible incentives. We haven't accounted for that. I mean, we are just seeing these institutions and these industrial complexes completely fail. And I think hopefully that's why this issue on healthcare is resonating a bit. It's I think it's a forward-looking way to frame this. It's like it's still happening, and it's fine. I mean, you know, I think we've gotten away from capitalism. I think we have co-opted institutions. I think we should, you know, have a free market, but like we should be talking about these issues. These are much more important issues to be talking about than these partisan kind of trivia games that we play that the media kind of tries to get us to divide us.